drug dependency has emerged as one of the major social problems in the Philippines and undoubtedly proves to be a major cause of criminality in the country. It was also a major hindrance in the proper growth and development of an individual, society, nation, and the world as a whole. It became rampant not only in Region 2, but throughout the nation as well. Hence, to address such social dilemma, with the signing of Republic Act 9165, otherwise known as the Comprehensive Dangerous Drugs Act of 2002, and through the efforts and able representation, Cagayan Valley region was included among the 10 priority regions, and the Department of Health Drug Abuse Treatment and Rehabilitation Center Region 2 was founded to bring hopes and changes to the victims of drug dependency. An initial funding of 50 million pesos was provided by the Department of Health and Dangerous Drugs Board during the administration of President Gloria Macapagal Arroyo. It is the first and only government-owned treatment and rehabilitation center in the region, located at Barangay Centro, San Antonio, City of Ilagan, Isabela, with a total land area of 1.97 hectares. With the other infrastructure still underway, the DETRC employees had their temporary office in a completed building intended to be a staff house. Dedicated service-driven employees said to endure the inconvenience and the possible hazards to achieve the agency's purpose. The center offers 3 programs: residential, outpatient, and aftercare program. The center is also equipped with fully functional secondary laboratory, dental clinic, and x-ray room. In order to achieve DETRC's vision of holistic and multidisciplinary team approach, the facility offers these treatment and rehabilitative services. In partnership with Tesla, clients were able to acquire new skills through the vocational courses offered by the authority. The Department of Agriculture demonstrated the appropriate techniques for vegetable gardening and production. Clients honed their entrepreneurship with the help of Department of Trade and Industry. Through Alternative Learning System program of the Department of Education, which is a substitute for formal education, clients who are out-of-school youth were able to obtain their diploma. Bureau of Jail Management and Penology personnel conducted training on bonzo making. Meaning behind the DOH-DATRC logo. A house represents the facility that serves as a home for residents or clients. People joining hands represents the caring community within the rehabilitation facility in collaboration with other partner agencies. The sun symbolizes energy, will, and clarity. The dove carrying a branch symbolizes inner peace, and the branch with leaves symbolizes hope. In the year 2017, DOH-DATRC was established. The City of Ilagan, through then Mayor Jose Marie L. Diaz, responded to the call and facilitated the donation of the lot where the DATRC now located. On June 19, 2012, a deed of donation was issued between Mr. Herwin A. Tolentino and Regional Director of DOH Region 2 in the person of Dr. Rio Lat Magpantay. On October 6, 2012, a MOA was executed between other agencies to establish the facility and to provide quality rehabilitative services. The construction of the facility started through the supervision of Cagayan Valley Medical Center, then was handed to DOH Region 2 and completed in the year 2014. On March 15, 2016, groundbreaking ceremony was celebrated with the presence of the officials from DOH Region, DOH DATRC, and the barangay officials of Centro San Antonio, City of Ilagan, Isabela. On September 11, 2016, Department of Interior and Local Government Undersecretary John Castriciones and Governor Daquila Carlo Cuo visited the DATRC. Dr. Charity I. Canapi was appointed as the Chief of Hospital 2 of the facility. On January 31 and February 4, 2017, the groundbreaking ceremony for multipurpose covered court and dormitory building Phase 3 was undertaken respectively. Newly appointed Chief of Hospital Dr. Charity I. Canapi rallied her team under pressure in the drafting of policies, protocols, manual of operations, which are primary requirements in the accreditation and licensing of the hospital. Finally, on March 24, 2017, a certificate of accreditation was awarded to DATRC Region 2 with 50-bed capacity. The Rehabilitation Center had its first residential admission on April 12, 2017. In June 2017, a simple Thanksgiving and inauguration ceremony was celebrated with the presence of DOH Secretary Pauline Jean Ubiol. In January 2018, Undersecretary Valle and Director Lopez visited the center for an ocular inspection. On March 18, 2018, Ms. Lourdes T. David, board member of the Philippine Librarians Association, donated books. The provincial librarian, Mr. Michael Pinto, together with the different representatives from universities, also donated books and visited DATRC. The first anniversary celebration was held on April 4, 2018. The Metamorphosis, a newsletter published by DATRC Region 2, was launched on the same day. Ribbon cutting and blessing of mini library, covered court, guardhouse, and the dormitory Phase 3 was also conducted. On July 2018, Undersecretary Enrique Domingo visited the ATRC. On January 17, 2019, the groundbreaking of NICA and EMU took place. On February 4, 2019, 5 DATRC family was certified as new DDB representatives.
Every humble beginning turns a great success. In 2017, there is only one building where all the personals work together. It is only a temporary constructed staff house having cement posts and elevated unfurnished floor. After 2 years, the administrative or administration building was constructed and is currently occupied by the TRC personnel under the Technical and Administrative Division, which is better, wider, and provides a great conducive environment as a workplace. As development goes along with the time, more buildings were built to expand the capability of the facility in serving. These buildings are the Emotional Motivational Unit Building, the Mentally Ill Chemical Abuse Building, Multipurpose Covered Court, and the second phase of the Dormitory Building. The following are also the facilities that were established to improve the delivery of services. These are Water Refilling Station, STP or the Sewerage Treatment Plant. Lastly is the powerhouse with the upgraded power line source. The DOH-TRC was re-accredited with the inclusion of ancillary services, the secondary level accredited clinical and drug testing laboratory, dental and radiology units. The recruitment of the DOH-TRC personnel started with 15 pioneer employees, and as to date, the growing number of members of this family nearly reaches the complete plantilla. In order to capacitate the workforce, continuous provision of trainings, learning, and development initiatives were provided. Through the assistance from the DOH Central Office, sub-allotments were extended to the DOH-TRC for improvement and upgrading of its IT equipments and services, providing the personnel their needs and adapting to the present situation, and for the implementation of telemedicine, teleconference, in order to comply with IPCC protocols to prevent the spread of the virus. We responded to the request of judges due to the immediate need for an increasing number of cases and the referral of adolescents to other TRCs. During the surge of the pandemic, the facility conducts triage to its employees and clients to ensure safety among the people who are at stake. The facility also provides regular COVID-19 rapid antigen tests to monitor each worker's current test results when entering the facility. The facility served as a quarantine area for staff who were exposed to COVID-19. This is to make sure that after having the result, the facility is ready to handle the situation to prevent other possible contacts. The IPCC put forward the following actions which the DOHTRC strictly complied to be able to help fight the COVID-19 from spreading within the workplace, and these activities are hand washing, social distancing, wearing of masks provided by the facility, creation of window transaction, and wearing of PPE for our frontliners. Created Infection Prevention and Control Committee, or the IPCC, recommends facility guidelines and protocols to be undertaken and assess appropriateness of proposed activities for the patients as well as the staff and personnel. Infection Control and Monitoring Team, or the ICMT, oversees the day-to-day infection prevention and control activities of the facility and monitors the implementation and compliance with infection prevention and control policies, guidelines, and procedures. And designated facility epidemiology and surveillance officers, or the FESO, which are responsible for contact tracing, assessment, investigation, reporting, and monitoring any cases of infectious or occurrences of diseases within the facility, and coordinates to concerned LGU for the appropriate management of affected staff and patients. All employees as well as the residents are vaccinated through the help of the City Health Office and the leadership of our Mayor Jose Marie Diaz. We would also like to express our gratitude for the fast approval and action of our Mayor for our road construction request. We would also like to highlight the DOH region for being supportive in combating the COVID-19 together with the facility. You all have been a great help, and the facility gives back a genuine appreciation to all the acts of kindness and service that you have willingly given through those tough times. Again, thank you very much. The 5th year anniversary of the facility, it is time to look back within its early age to what it has successfully become now. The facility continues to achieve and develop in all aspects with the able leadership of our Chief of Hospital 2, Dr. Charity Canapi. It has